Okay, 60 Minutes yesterday. This is incredible. Lewis texted me last night saying, Romney's on 60 Minutes, he's got the brown face. So I tuned in. And incredibly, Mitt Romney was asked about, do people deserve some basic level of health insurance? And he said, uninsured people can just go to the emergency room. Mitt, that's the problem. The problem we're trying to solve is uninsured people going to the emergency room. That's not the solution. Here he is talking to Scott Pelley.
Does the government have a responsibility to provide health care to the 50 million Americans who don't have it today?
Well, we do provide care for people who don't have insurance. People, if someone has a heart attack, they don't sit in their apartment and die. We pick them up in an ambulance and take them to the hospital and give them care. And different states have different ways of providing for that care.
That's the most expensive way to do it.
Well,
in the emergency room.
Different states have different ways of doing that. Some provide that care through clinics. Some provide the care through emergency rooms. In my state, we found a solution that worked for my state. But I would.
It's so hard to believe he's even saying this, and I'll talk about why. But Mitt Romney's got to finish the debate with himself. You know why? Because recently on Morning Joe, he said one of the main problems with the healthcare system is uninsured people going to the emergency room. This is not Mitt Romney and my point of view. This is not Mitt Romney and President Obama's point of view. This is Mitt Romney arguing with something he said just a couple years ago. Listen to this.
Collaboratively, back here in the domestic stage, you and the late Senator Kennedy worked collaboratively on establishing a health plan in Massachusetts that basically encompassed on a statewide level universal coverage.
Yeah.
Do you believe in universal coverage?
Oh, sure. Look, it doesn't make a lot of sense for us to have millions and millions of people who have no health insurance and yet who can go to the emergency room and get entirely free care for which they have no responsibility, particularly if they're people who have sufficient means to pay their own way.
Wait a second, Mitt. So you're saying if people have the money to buy insurance, we need a system that prevents them from choosing not to buy the insurance, calling up the ambulance, going to the emergency room, and getting a whole bunch of service that they're not covered for and maybe aren't going to pay for. Great back and forth on this topic. It's just that it's the same guy arguing with himself.
Yeah. Typical Mitt Romney. But
I mean, his way the way he's suggesting fixing this is the problem.
Right. And another big problem is that he will not get called out on this in any of his interviews because they're all softball, lame.
Well, Scott Pelley did at least say that's really expensive.
He didn't push it nearly as hard as he could have. And it sounds like he didn't want to bring up, which I'm sure he knew about, the clip we just played.
Natan, it's weird that he's even making statements that are just so easy to refute, don't you think?
Yeah, it's unclear who. I mean, he's obviously trying to appeal to the Republican base, and the Republican base doesn't agree with this idea of any word like universal, state-sponsored, Obamacare. All of these terms don't appeal to the people that he's trying to appeal to now.
Right.
But who was that guy in the video 2 years ago on Morning Joe? I mean, it seems like that's a reasonable guy who I could vote for. Too bad he's not running.
I don't remember. He looks familiar, but I don't remember who that was. Do you really not know, Natan?
He's talking about Mitt Romney.
Oh, I thought he was talking about the guy asking the questions.
No, I'm talking about
No, the guy
Mitt
asking
Romney.
the questions I thought was making really good
is.
points. Confusion. Okay. Yeah, no, that Mitt Romney wasn't that bad.
That was Mitt Romney agreeing with our views on what the healthcare system should be.
Incredible.